I need to talk about oral surgery, of course, but just first I want to show you our dental institute or our dental school from the university. You can see it in this picture, and this picture was taken from the homepage of one of the news papers today, and it's saying that one of our dentists has been infected. So that was like yesterday, the situation. Nowadays we have more than one infected, and so things are increasing, which is quite a stress, as you may imagine, because there's a lot of open questions about protection of people, both patients and dentists, of course. In this graph, also from this morning, you can see the distribution of the identified corona cases in Switzerland, and up here you can see Zurich, and as you can see, we are the champions, even if we don't want to be that. But it's going further. Here in Bern, there's our government located, and even there's discussions going on whether they should do their sessions at all. And one of our politicians, as you might see in this picture, is walking around with protective gear, and that has led to a lot of discussions. So that's the situation here. You're more or less updated now. We have 100 and something cases of corona in Switzerland and increasing by the hour. So I hope you are spared from coronavirus. And that's one of the reasons why I could not come to Moscow, because I didn't want to be the one that brings it to your beautiful country. Okay, let's get started with the real topic. So we have a lot of surgical interventions in children, and you must know that I am a pediatric dentist by origin, and I just drifted into oral surgery in children because the oral surgeons, they didn't want to do it. They didn't want to deal with children. So the easiest of all interventions, of course, are extractions, as you do it in daily practice, and treatment of infections, a topic I will not cover because of the time. Then what's interesting, because it's not so common in the daily practice, is extraction of displaced or supernumerous teeth, odontomas. I will show you something about that and show you some videos. Then treatment of cysts are very important in children. We get to see a lot of differences, both in soft tissue and in the bone. Then frenectomies, also a very typical topic for pediatric dentistry. Then some soft tissue pathologies. I just show you very few of them because that would be a topic for an intervention on its own. Then surgical exposures, we do quite a lot because we are together with the orthodontic department, and they need a lot of exposures, and we do a lot of chains on teeth that have to be brought into the occlusion. Then we do quite a lot of transplantations. Also, that's a topic. I will show you something on it at least, just give you the idea of what you can do or what can be done. And then, of course, some other things. So that's what I'm basically trying to talk about in the next minutes or hour or so. Now let's start with the very daily things. And I'm not going to teach you anything because you are all pediatric dentists and in some instances certainly more experienced in extractions than I am. And it's just for me an important topic because it's kind of traumatizing to the teeth or to the children, and we sometimes do not realize how traumatizing it is because we are so used to it, and of course we do good local anesthesia, pain control, but for them it's a big deal if they think of having a tooth extracted or some other operations done. So primary incisors basically are very common to extract.